Well, this Saturday, Catholic Health's Mercy Hospital is hosting an important webinar on COVID-19, the hidden impact on mental health, substance use, and addiction. And joining us now via Skype is Dr. David Flomenhaft, the hospital's director of Outpatient Behavioral Health Services. Thank you for joining us today.
Thank you, Colleen. Glad to be here.
This is just so important, and this is going to be so ongoing. You'll be handling the impact of COVID-19 on mental illness. Tell me what you're seeing.
Well, it's been a very tough year for all of us. I think we could agree. We've lost traditions, celebrations, jobs, and loved ones. It's been a time of increased anxiety and uncertainty. We're entering an interesting phase now with increased vaccinations on the rise. We hopefully are exiting what would be called a liminal period, this period of sort of neither here nor there, but there's still a lot of unknowns. Some clients refer to this as Blur's Day, you know, that Groundhog Day experience. We've witnessed an increase in need for mental health and substance abuse services. Anxiety and depression have been on the rise, as well as substance abuse problems. So we hope that people will take advantage of this opportunity to access the benefits that all of us have, for the most part, for mental health and substance abuse services and get treatments. Don't let the stigma of this issue prevent you from getting the care that you need.
Yeah, we just had a report here on Long Island that during COVID, Nassau County, maybe a 32% increase in fatal overdoses, 12% in Suffolk County. So, you know, the anxiety, well, first of all, the anxiety, people leading to drug use and also alcohol use, but there's so many different things impacting people. We talk about, you know, some lost loved ones. Some people were sick and now facing this long haul illness, which I think could be leading us to depression with some people. And it's affecting all age groups. It just, right, to me, seems so, you know, widespread here.
That's right. So substance abuse and mental health issues, including anxiety and depression, were adversely affected by the isolation that we all encountered during this past year and a couple of months. Being cut off from others, from routine, from going to your place of work, your school, and all the structure that involves. So the isolation kind of breeds a lot of discontent. And people also kind of cut lost their access to self-help meetings in person. Many went on Zoom to AA and other support groups like that, but it doesn't replace the in-person contact. I will say on the positive side, the telehealth for both medicine and mental health services has been a tremendous benefit. Our requests for services have been up 30%. We've been able to, you know, cut down on the typical things that would interfere with getting to your appointment, like travel and weather-related events. But still, the lack of contact that we have with one another, hopefully, which is beginning to kind of improve with vaccinations. But we still have a big problem with people getting the care that they need. This conference will address the ongoing issues around stigma and also the issues related to suicide, which I want to talk about in more detail.
Okay, when you talk about stigma, you mean stigma to get help?
You know, there's been in our society a reluctance to kind of address our mental health issues. You know, medical care, you know, very few people would hesitate to take care of their needs. Do any one of us question why we shouldn't brush our teeth, you know, once or twice a day? Why isn't mental health care, substance abuse care, considered on that same level of adherence to taking care of ourselves? You know, mental health care ought to be a regular part of our routine. Everything from you know, taking a walk every day, looking at how we spend our time, looking at the substances that we put in our body. This is all part of, you know, good self-care. The other part of good self-care is talking with those that we love and are close with us, whom we're concerned about. So being to open a conversation, you know, when we see someone in distress. What we've noticed is that about 40% of the people that have had an experience of anxiety or depression have had a thought about suicide. 10% of those people have even contemplated acting on those thoughts of suicide. So what we want to do is encourage people to have dialogue with those that they know, that they're concerned about, and just ask them the question, have you ever thought of taking your life? Asking the question doesn't plant the idea. It just opens up the conversation. And for those that are really interested, there are resources like mental health first aid that you can learn as a skill to become more comfortable with engaging people who you think might be at risk.
Wait, talk a little bit more about that. How would I know, or somebody know, maybe somebody is at risk? What are the things you should be looking for? You fear somebody is thinking about suicide.
So for both children and adults, what we look at is a change in their behavior. Typically, they're more isolated, more cut off. There may be a reduction in their caring for themselves. Activities of daily living, showering, eating regularly. If they begin to give away any of their possessions, if there's an increase in the abuse of alcohol or other drugs. These are signs and symptoms that there's been a change in mood. So you want to engage that person in dialogue. How are you feeling? What's going on? Is there anything I can do to help? Have you thought about ending your life? We have this unfortunate attachment to weapons in our society, and there are 400 million guns. So the access to lethal means that our suicide rate is even that much higher compared to other countries where there's less access to weapons. So because we have so many homes that have weapons in them, suicide is often more fatal, whereas in other countries it might be attempted more often. It's less fatal.
I'd like to talk a little bit about the possible long-term effects of this that we don't know right now. Especially, I'm thinking about essential workers, healthcare workers who have been just for a year now, what they've been seeing. Could there be PTSD issues down the line that people don't even know they're experiencing?
Yes, the essential workers, they include our healthcare workers, food and service delivery folks have taken care of us for the past year and a half. They've always taken care of us. The COVID cases still remain at the hospital, not at the same rate. So that I'm concerned about the nursing staff and the healthcare staff who still continue to be on the front lines of dealing with a very challenging issue. In terms of the long hauler COVID cases, we're beginning to understand more and more about what they've faced. The research shows that they have pronounced fatigue that goes on for months and months after their illness. PTSD, or post-traumatic stress disorder, is a symptom that some of those people have experienced because they've been on ventilators or supported breathing. So that fearful experience of coming close to death has left some residue of anxiety and fear about their recovery. We are seeing individuals come forward and ask for treatment because they feel that they've sort of lost their step. Depression, anxiety. There's good treatment for these conditions. Supportive talk therapy and medications can help alleviate some of the symptom burden. So we advise people to talk to their healthcare providers, get referrals to mental health services, and if you're in a dire state, you're thinking about ending your life, please reach out to your healthcare provider or reach out to call the National Suicide Prevention Line, and I'll provide the number at the end.
Okay, this webinar, so important, Saturday, April 17th, but people need to really register today for it. So I want to give out that phone number for more information, which is 516-705-2618. And if you would like to give out the suicide prevention number, please do that, Doctor.
Okay, so this is the National Suicide Prevention Lifeline. It's 1-800-273-8255, 1-800-273-8255. If you're interested in taking a mental health first aid course, please Google that. There's another course called Question, Persuade, Refer. That's also a shorter kind of training to help those people become more equipped, both for children and for adults, to learn to engage people in a dialogue, to be really a lifesaver for someone's emotional health.
Well, Doctor, thank you. This has to be an ongoing dialogue, and you are welcome back in the near future. Please come back.
Thank you.
Thank you very much.